Hello and welcome to the Her Story podcast. I'm your host Beck, here to bring you candid interviews with women from all walks of life, holding space for women to be vulnerable, share their life experiences, things they've learned along the way, and really helping other women out there to feel seen and validated in their own experience. So thank you for taking the time to be here. Let's dive into today's episode. Welcome to the podcast, everybody. Today I have Rachel Fitzpatrick with me. I'm super excited for this interview. She's a acupuncturist and Chinese herbalist. So thank you for coming on, Rachel.
Thank you. Thank you for having me, Beck.
Yeah, I'm really excited for this. I stumbled across Rachel on Instagram and been following her, and she's doing some amazing stuff and sharing lots of great content. And this is actually something, acupuncture, that I've been experiencing myself here in Perth. And I really wanted to interview Rachel and talk a bit about her journey. So Rachel, tell us a bit about you, where you're based, because I think you're on the other side of Australia, and I guess what inspired you to move into this area.
Yeah, awesome. Well, I'm Rachel. I'm an acupuncturist and Chinese medicine practitioner, and I'm based on the Gold Coast, but I do work a little bit in Brisbane as well, in a clinic in Brisbane and a few clinics on the coast here. I guess, how did I get into acupuncture? It's a bit of a long story, but I think I always was drawn, even as a child, to do something in the way of helping people. And I remember, mixing up little potions and things in the backyard, that sort of thing. And I used to play vets with my stuffed animals. So I think the fact that I guess landed in a healing profession was not a surprise to me. But yeah, I guess I fell into it later in life than when I was faced with my own kind of health challenges. And I had just tried so many different things, and was not being supported, I guess, as best as I thought I could have been supported through Western medicine. So I was diagnosed with PCOS, and I since then have also been diagnosed with endometriosis and atypical hyperplasia, a few different things. So that's been an ongoing thing for me for the last maybe 15 plus years, really. And I actually originally started to study naturopathy. So I was working at the time in this little shop in Southport called Happy High Herbs, and we were selling different kind of teas and herbs and things. And I remember flicking through one of the books there, and there was actually a couple books there that really piqued my interest in herbs and things like that. So I thought I wanted to study naturopathy. So I started out doing naturopathy, and halfway through my first semester, I ended up having a menstrual bleed, a really heavy menstrual bleed, very painful, super clotted, and it went on for about 16, 17 days. It just was not stopping. Wow. So I'd been trying all sorts of different things, been back and forth with the GP, back and forth with different kind of herbs and other modalities as well. And it was actually a lecturer of mine at the time who said, why don't you go and try acupuncture? And I hadn't actually I hadn't had acupuncture before, hadn't received acupuncture before. My knowledge of acupuncture was really quite basic. I knew that it involved pins, but beyond that, didn't really know what to expect. And I'll be honest, I actually was really quite skeptical, but by this time I thought I was just so desperate to do something, And so I went and I had my first treatment at the student clinic. And I had, a few pins put in. One specifically, I remember going into a point on my big toe, which I now know, having studied, is spleen 1. And it is a stop bleeding point. And I just remember thinking on the table, how the heck is this going to stop my bleed? Anyways, fast forward to that afternoon, I really slowed to more spotting. And then the very next day, it fully had stopped. So The
Wow.
following day, I met with student services and I was like, can I change to acupuncture? I need to know more about this. I need to know why it worked, how it works. I just couldn't wrap my head around it. And I just was so super curious of, like, how has this made change on the table just so quickly? So that was my first experience with acupuncture. And yeah, so I switched over to Chinese medicine degree instead of naturopathy. Um, and here we are. Now I'm an acupuncturist. So yeah, that's
Wow.
pretty much where I guess this journey's led me.
Wow, that is amazing. Thank you for sharing
Mm,
that. I think there's
yeah.
so many women just like you as well on this same kind of journey. And I've been on it too, just back and forth. What can I
Mm,
do that's going to help me in this situation? Um, so thank God for acupuncture.
yeah.
You found a modality that's like, well, my body, like what's going to help? That's
Yeah.
phenomenal.
Yeah. And
Oh,
now I still
wow.
see an acupuncturist regularly, still myself, and I do find it keeps me so much more regular in terms of my menstruation. And it just helps with, for me, just balancing that kind of PMT luteal phase type stuff as well. Um, it's really like been a game changer for my energy as well, because I've had a lot of kind of chronic fatigue, adrenal fatigue type stuff come through with the hormones and all the other diagnoses and things like that. So it really just, I think at this point, really helps just keep me on track and well.
Mm-hmm.
So yeah, I couldn't recommend it enough, really. Yeah.
Yeah, amazing. So just for those who might have not had acupuncture, like what is it? What is involved? What's happening in the body? Like what is it doing?
Yeah. So I guess on a very basic, Chinese medicine level, the whole aim of acupuncture or Chinese medicine is to just simply balance our qi, our blood, our yin, and our yang.
Mm,
So we look at different pathologies or symptoms in the body as a
mhm.
result of either an excess or a stagnation in
Okay.
either an organ or a channel, or a deficiency in that organ or channel. Or sometimes there could be a few things going on at once. So there could be an excess pattern somewhere, a stagnation somewhere, or there could be a deficiency somewhere else. And so what we're really trying to do is just determine, which organs or which channels or meridians are affected, and how are they affected? Are they excess? Are they deficient? Are they stagnant? And then we are trying to influence the qi, whether that's by building qi or building blood, building yin or yang, or just moving the qi, moving the stagnation. Um, and we do that by inserting pins into specific acupuncture points that have specific actions. So yeah, that's that's how we approach it. So we do this, primarily through acupuncture, but Chinese medicine encompasses a whole range of different things as well. So we will often look at Chinese nutrition therapy, which is very different to Western nutrition. So we are still kind of looking at the nutrient density of foods as well, but we are really looking at the energetics of food too. So is it blood building? Is it going to build yin or yang, or is it going to help move qi, that sort of thing?
So
So
chi is you're talking energy, right?
yeah,
Yeah.
yeah. So
Okay.
qi, you could look at, it translates to energy. You could look at it as energy, or I've seen some I guess theories out there talk about it more in terms of breath or oxygen, or
Mhm.
so it's ambiguous, I suppose, chi, but I look at it in terms of energy. And yeah, I mean, qigong, the activity qigong, is literally translates to breath work. So we're
Oh,
moving with the breath. Yeah. So a lot of modalities, I guess, look at it as breath or energy. So I definitely look at it as energy. So we're wanting to move that energy around the body. Um,
so that's the
and
same with the yin and the yang. Is that like the feminine masculine energy or what?
yeah, so the yin, and we are all made up of both yin and yang. So we're not exclusively yin and we're not exclusively yang, but we can certainly look at that kind of more as that masculine or feminine energy. Or oftentimes when I work with women's health particularly, we often liken the yin substance in the body as to like the estrogen, and then the yang substance is often that progesterone as well. So when I'm looking at like bloods, for instance, and I might see there's a progesterone insufficiency, often when we diagnose, I suppose, from a Chinese medicine perspective, it will correlate to like a yang deficiency. So we want to boost the yang and boost the progesterone.
Right. So you're putting these needles in these specific points to get things moving and flowing and
Yeah,
right.
exactly. And then we can always approach it, like I said, with your Chinese nutrition therapy, with movement therapy as well. So Qigong, Tai Chi, that sort of thing. Lifestyle stuff comes into it so much as well. So managing stress and things like that. And of course, herbal formula. I don't dispense herbs, but I do dispense like your patent herbal formulas, so already made up formulas. So we use the traditional Chinese medicine formulas at times as well to support that either tonification of qi, blood, yin yang, or to help move stagnation or heat or damp or things like that. Yeah.
Yeah, right. That's just fascinating, isn't it? So in your clinic, do you work mostly with women, women's health? What are some of the common things that you see, I guess, with your clients?
Yeah, so mostly women's health, so hormone imbalance, whether that be a diagnosis like PCOS, endometriosis, fibroids, hyperplasia,
Yep.
all of the things. Even just like PMT or PMDD, that sort of thing I see a lot of.
Yep.
And then I guess the bulk of what I treat is preconception, whether that's natural preconception and fertility support, or supporting women that are going through IUI, IVF, or perhaps like a monitored cycle on letrozole or Clomid or something like that. So I've found that acupuncture really can help with managing the symptoms of some of the medications that these women are taking while they're doing like assisted reproductive techniques. And it does help improve the efficacy of the program that they're on as well. Yeah.
Oh, okay. Yep.
And then
Yep.
naturally, I guess because I'm helping support women through that fertility and preconception journey, then I've found myself as years have gone on that then I'm supporting them through their pregnancies and then postpartum. So there's just, it's a grand scope of things, I suppose.
Yeah, absolutely. It sounds quite intricate, and you could work with so many different people at different points in their life as well, whatever they're kind of going through. And so, with
Mm.
let's say you're working with these women who are trying to get pregnant or are pregnant, so it's safe at any stage. And is there any kind of particular time, like if someone was trying to fall pregnant, um, is there any particular time they should come and see you in their cycle?
Yeah. So, it's safe to do at any time of your cycle. If you are trying to conceive, there are certainly some points that we avoid in the luteal phase in case you have fallen pregnant. So there's a few points that we just avoid, but throughout pregnancy, it is safe to receive acupuncture. We just avoid particular points during that time. And then we might start to begin using those points again from about 36 weeks as like a labor preparation.
Right.
If you're trying to conceive, generally, look, I'm flexible with what works for the person presenting, depending on what their schedule's like and and just what works for them. But generally, as a guide, I would recommend to see me weekly or see a practitioner weekly for about 3 months in that preconception journey. And that gives us enough time to really influence some change. But it also gives us time to observe maybe a natural cycle of yours and then observe if there's any changes in the next few months. So that's definitely what I would recommend is weekly treatment. And our treatments will kind of change depending on the phase of cycle that you're in. So obviously during the menstrual phase, we'll be really focusing on blood. During the follicular phase, it's all about yin. Ovulation, we'd talk a lot about lifting yang and lifting that progesterone. And then, leading into that luteal phase, we're looking at kind of moving the chi, because that's a phase where we often get a little bit of chi stagnation, and that's what drives our PMT or PMS type stuff going on. The treatment will change a little bit. And then during that, I guess, follicular phase, oftentimes when we're looking at preconception particularly, we are looking at getting a lot of circulation through to the ovaries, through to the uterus, making sure we've got some nice, good, juicy follicles, nice, thick, sticky lining for implantation. So often I'll do a fair few pins in the belly and get the heat on. So we usually do the heat, or might use some moxa, which is a herb that we burn over the top of the needles. And that will just get a lot of circulation happening to that reproductive center. And then luteal phase, we really want to just leave, that little embryo alone. So we leave it to do its thing, and we really shift our focus to supporting the nervous system, because we know, I guess in Chinese medicine, that our nervous system and our stress and what we're holding in our body has a real direct impact on whether our body feels safe to conceive. Yeah.
Yes, that's what I wanted to ask about, was what do you think is causing a lot of this stuff? Is it stress is such a big thing, isn't it? And then it's impacting the blood, and you want that circulation, everything to flow. And I think when we're stressed, hey, it has such an impact on our body and how it functions, doesn't it?
100%. And I think too, like our modern stress is so different to how it used to be, where we're seemingly under constant stress. There's very little time of reprieve in between stresses, whether that's like, a deadline, or perhaps it's, financial stress, or whatever it is. Parent life. Yeah, exactly. Like there's so much going on all the time. And I think years ago, a lecturer of mine said to he brought up and said like that, I can't remember if he read it or heard it somewhere, but it resonated with me, so I've remembered it. But he said something to the effect of the amount of stimulus that we are exposed to in a single day is far exceeds the amount of information that our ancestors were exposed to across their lifetime. And
yes,
I'm definitely seeing that, and it's even things that we don't think are particularly stressful, but we're constantly taking in information. So whether that's, clocking the time on your phone, we're driving down the road and we're, clocking a car here, car to my left, car to my right, who's, back there in the rear vision mirror, traffic light there, billboard there, fluoro lights there. Like it's just a constant taking in of information. And so while our stress is really different to how it used to be ancestrally, our body only knows to respond in one way, the same way, which is, oh, I'm stressed, I must be running from a tiger, or I must not be having shelter, or I must be in a time of famine or something like that. And so our body, regardless of what the stress stimulus is responding as if that's happening. And so the way that it responds is it pumps our limbs with blood so that we can run and move really fast. It takes the circulation away from our digestion and our reproductive organs, because it's not safe to reproduce, and it's not safe to rest and digest because we're on the run. Or we might not have enough food in our system to actually bother with digestion, And so really, I guess Chinese medicine is wanting to bring that blood flow back to the vital organs where they need to be to nourish ourselves, and away from that kind of fight and flight response, and kind of center ourselves into rest and digest. And so that we can focus on just getting some really good healthy blood flow, chi flow to our vital organs.
No, absolutely, you're right. And we are constantly, I think, peeking into that fight or flight on and off during the day. I mean, generally, if you should only be there in like what 30 seconds and then come back down to ease,
Yeah.
hopefully maybe for the rest of the day. But no, it's just like
Yeah,
constant
it's
wave of it,
constant
isn't it?
now. And I think, yeah,
Mm.
ancestrally, they did have, although the stress was seemingly much worse, it was, I guess, shorter lived and longer times of reprieve in between stresses. Whereas
Yes.
now we're like constantly facing micro stress. Might not seem quite as dangerous as, you know, running from a tiger, but it's the continuity of it. It's just micro stress
Mm.
after micro stress after micro stress, and we're not getting the time of reprieve in between. So we're not getting that time to really wind down.
Oh, absolutely. And I mean, if we're constantly in that, what's happening to our body? Are we building up that stress? And then that's when all these issues are happening in the body. So the next time you go into
Yeah.
acupuncture, you'll be like, okay, I
Yeah.
can actually.
Yeah, I think that exactly, yeah, that exactly that. I think that it does build upon, and it becomes harder to wind down. I don't know if you've heard the term wired but tired, but we use that a lot in Chinese medicine, this wired but tired. Yeah, yeah,
Felt
like
it,
we are
felt it.
depleted, but our adrenaline is still just so high. Our adrenaline and our cortisol is still so high. So it compounds over time, and then it becomes really difficult to switch out of it. And so, yeah,
Yes.
acupuncture, if nothing else, can just help kind of you switch out of it. It's funny, like here in Australia, we do, I do 45 to 60-minute treatments,
Mm.
and you'll get at least 45 minutes on the table. And while I'm putting the pins in and they're working their magic, I almost think that the bulk of the treatment is being forced to lay still for 45 minutes. You can't move. You just have to
Yep,
lay here.
I agree.
Yeah, yeah. I think that is honestly, yeah, a huge part of the treatment is actually being forced to actually, yeah, lay down, stay still, switch off, just focus on your breath. And just the ability of the pins and the acupuncture to actually just bring you back into your body is
Hmm.
amazing. Yeah.
Oh, absolutely. And I can attest to it. Like for a long time, like you said, I was going weekly to a point, and then I've got it like fortnightly now. I'd love to just keep going weekly because it's just
Yeah.
amazing. But yeah, doing it fortnightly now, and once you literally still got all your needles in, you actually
Yeah.
start to focus on your breath. It's calm in the room, and it's almost like you're sinking into a bed or in the bed, but into like a cloud. And
Yeah.
it's like, I just want to hold on to that feeling forever because it just feels so good. And then you
Yeah.
really start to notice how stressed and heightened you are throughout the day. And you're like, oh, I'm becoming way more aware of it. Now I'm like, I'm just going to stop for 10 minutes and do some deep breathing, like something to bring me back.
Mm.
It's
Yeah,
just,
100%. Its ability to just get you to a point where you're more intuitive with your body is so important
mm,
as well. And yeah, I often find that the first few times I'm seeing someone, they might struggle to switch off a little bit, but then once they kind of get in the rhythm of things, it's almost like trains their body to go, oh, now is my time to just, sink in, go inward and like really be in my body. And then the more capable they are of finding that later in their day as well.
yes, absolutely. Like, oh, yeah, that's what that feels like. I need to do this to bring me back
Mhm.
to feeling like this.
Yeah, 100%, 100%.
Oh my God. So I guess with postnatal women, because I found this
Hmm.
helpful throughout that stage too, like I feel like there's just so much change in a woman's body, like obviously throughout pregnancy, once you've had their baby, but in that sort of window of that fourth trimester, I guess you call it. Would you highly recommend acupuncture then to kind of help? Because I feel like your hormonal profile is just completely different. There's a lot of change in the
Definitely.
body. Would you recommend someone coming in, sort of give them that 6 weeks and then come in, or is there any kind of recommendations
Yeah.
around that?
I actually offer postpartum home visits within the first 6 weeks. So I'll actually come out to them so that they're not having to, bring bub in, or, it's just less stress, and it's nice to go out and be able to nurture someone in their home as well where they're comfortable. But yeah, definitely after the first 6 weeks, I would recommend, coming out to see someone. It just helps to replenish the blood stores. It helps to replenish the kidneys and the spleen and the liver, which all become quite depleted through postpartum and through birth. And then especially too with breastfeeding mamas as well, breast milk in Chinese medicine is seen as an extension of the blood. So if we've lost a lot of blood through a vaginal delivery or any kind of complications, then it is difficult. I have seen, I suppose, that it is more difficult for women for their milk to come in and things like that. So we want to really nourish that woman really in the beginning, make sure that their blood stores are getting replenished enough so that the breast milk can come through. And then also, as they continue to breastfeed as well, that's a further depletion of the blood in Chinese medicine because it's seen as an extension of the blood. So we want to really make sure that their blood stores are good, and then that helps for them to feel a little bit more vital. And having, healthy blood stores is going to help, with, like we see it definitely as a huge contributing factor, for postpartum depression, anxiety, sleep. I mean, of course, you're waking with night feeds and with bub anyways as well, but just the quality of the sleep that you're getting as well really is impacted by how much blood and how vital you feel, so being able to get quality sleep in those little in-between times. Super important. And then just for healing as well, often with Caesar mums, we treat the scar as well. So because there's a lot of channels that run through our abdomen. And so we want to make sure that those channels are, I guess, reconnected and just making sure that we can minimize the amount of stagnation that happens as a result of, some scar tissue buildup and things like that. So we want to soften things and just make sure the chi in the blood is moving through there adequately. So so it can help with recovery that way as well.
Yeah, that's awesome. So these channels, is that kind of like the channels of energy or like the meridians you talk about? I know in acupuncture they've talked about them.
Channels, they've kind of used interchangeably, but we've got many channels that are running through down our abdomen. So we've got our liver, stomach, spleen, kidney, conception vessel channel, all running through down our abdomen. So when we, I guess, have a Caesar mum, we're cutting across all these channels. So we want to make sure that they're all matched up again. And often I find after doing the scar bridging, which is a technique that we use where we put a lot of pins in and around and underneath the scar tissue just to soften the scar tissue, break it up and reconnect those channels. And that can help with things down the line like digestive issues and things that result, I guess, from adhesions, internal adhesions of scar tissue. So menstrual irregularity and digestive stuff is a massive one.
Yeah, absolutely. I didn't realize, you could actually do that with the scarring, doing the needles around and into help. Wow, that's fascinating.
Yeah, it's not common. I feel like it's not commonly done so much anymore. Like I see a lot of women come through and they may have been seeing a practitioner, but there's never been any scar bridging done. Or I'll ask, have you had any scar bridging? So I don't know if it's maybe just not commonly practiced anymore, but I definitely do scar bridging, and you can do it years later. It doesn't have to be within that first 6 weeks or first 8 weeks or 12 weeks. We can do scar bridging years later, and I've seen it help. Yeah.
Oh, wow. So it's never too late if you're still having issues. It's like, come on in and let's try this, do something else.
Yeah. It's just about lining channels up again, just making sure, that chi and that blood can flow through rather than get stuck. Yeah.
Yeah, okay. So with the Yeah, that's amazing. So with my acupuncturist Ian, he's always talking about that. It's all about blood. It's all about the blood quality.
Yeah.
So doing the acupuncture, and we're doing some herbs at the moment, which actually tastes pretty good, I have to say. I
Oh,
thought that would
you
be
must have
gross,
got a
but
good formula because some
he,
of
he
them don't
actually,
taste very good.
yes, I've had some like pre-made, but then he's starting to make his own. So I'm not sure where he sources them from, but they
Yeah.
seem quite effective. But who would you recommend them to? Because some people might say, no, I'm quite happy to just do the acupuncture, or you might want to recommend herbs to someone. Would you recommend them to every patient who comes in, or is it more of a specific
Oh, it really
issue?
depends. Yeah, I really look at it on a case by case basis.
Mm-hmm.
Often I'll actually see how the acupuncture is going, first. So I might say, let's do 4 to 6 weekly treatments and we'll reassess. And if we're getting some progress with the acupuncture, awesome. If
Mm-hmm.
we are maybe not getting as much progress as I would like, then I might look at, okay, let's add some herbs in or some supplements, or let's look at maybe some dietary stuff as well. I like to see where the acupuncture, how it is affecting the person too, because some people are just really great responders to acupuncture, and then other people, they need a little bit of something else. But I also think too, it's it's it depends what's happening as well. I feel like acupuncture is quite dispersive by nature. So it's really good at moving stuff. It moves the energy. So when we have someone that's really got a lot of stagnation,
Mm-hmm.
acupuncture is brilliant. And we can move stagnation with herbs as well. There's definitely heaps of herbal formulas out there that help move stagnation. So we can do that with herbs as well. But I feel like acupuncture is really, like, it does that really well. And then if we've got someone who's really, really deficient, acupuncture, it can tonify too. But that's where I really look at herbs and nutrition stuff, because it's so much about what's going into our body as well, especially if we've not got the substance there to begin with. We want to put that into the body. So that's where I'd really lean on herbs. So women with blood deficiency, always I look at herbs and nutrition stuff. Yeah, yeah.
Yeah,
That, I
no,
guess
that's
that's, yeah.
awesome.
Yeah.
Yeah,
And I
and that
think
they can look at all the, holistic look at it all, like what's going in, like what are you getting in your nutrition, and like, yeah,
yeah.
that's really good that you can look at all of that. Yeah.
Yeah, generally the first time I will see someone, I'll do a treatment plan, and that might include some testing that we might get done. So I'm really big on getting bloods and stuff, especially fertility stuff. Um, and so we might look at getting some testing done, and then I'll usually look at supplements. What are you already taking? What can we tweak? We'll look at
Hmm.
Chinese nutrition therapy, Chinese herbs. Chinese
Awesome.
exercise therapy as well, and lifestyle stuff. So usually I'll look at that the first time, then we'll allow, a couple of weeks to see what the acupuncture does, and then that gives them some time to go off and do some testing if they need to do some testing. And then usually at that 4 to 6 mark, we'll start to like review everything, and we might go, okay, yeah, we definitely want to put you on a vitamin D or an iron, or let's put you on a
Yeah, awesome.
Chinese herbal formula or something like that. So yeah, it's a really holistic approach, which is what I love about it, because I think, yeah, there's a tendency, I suppose, in Western medicine to not correlate certain symptoms together. Like
Mm.
they might, especially when there's like mental, emotional stuff and then physical body stuff. It's like they, I think they have it. I think it's getting better. I will say I think it's getting better, but I think there is still a real separateness. Whereas in Chinese
Hmm.
medicine, like it's so emotionally we look at the emotions so much, even if there's purely physical stuff going on. We're really looking at the emotions and tapping into that too. So I like to incorporate all these different facets of Chinese medicine, because it helps as a whole. It helps the physical symptoms, and it can help support the mental, emotional, and the stress and nervous system stuff as well that might be kind of being overlooked.
Hmm. Yeah, absolutely. Yeah, absolutely. Yeah, well said for sure. Um, and with you talked about like stagnation, I guess, and would that be, let's say if someone's got stagnation or stored like trauma, like stuff like that, and they're coming in, would that and acupuncture helps release all of that and start shifting things as well when you look at it.
Yeah, definitely. Like
Yeah.
from a trauma perspective, yeah.
Yeah.
Any kind of, I guess, emotions we look at as energy and motion, right? It's got to be moved through. And I
Mm.
find sometimes, I think talk therapy and psychology is brilliant for helping to process, like the talking and processing of the emotion is like super essential. And I think they get some fantastic results. But sometimes I do see that the emotion is still stuck in the body as a form of
Mm.
stagnation, whether that's, liver chi stagnation or, maybe like a blood stagnation or something. Like there's, I guess, always a physical manifestation of that blocked emotion. So sometimes the talk therapy, I think, is really great, like I said, to process, but sometimes you need a little bit more of that energetic, somatic kind of release to actually shift through it.
Oh,
I
yeah,
think
I
that's super important.
100% agree. And even
Yeah,
speaking from my own experience, I'm like, the talk therapy is great, but honestly, like acupuncture, kinesiology, it all, you need that
yeah,
somatic work.
yeah.
Absolutely.
Yeah. Yeah. For
Yeah.
myself as well. I feel like I've done years and years and years and years of talk therapy. And I do think that it really has helped me process, like I said, like it's helped me come to understand how certain things have panned out, or maybe why someone's behaved in a certain way, or maybe why I've behaved in a certain way. It's helped me understand and intellectualize and process the experience. But it wasn't until I guess I started getting acupuncture and myself getting kinesiology as well. I love kinesiology,
Mm.
that I was able to actually shift the energetic trauma that was stuck,
Yeah.
because there was a long time there where I thought, hey, like, haven't I worked through this? Like, what's the deal? I've worked through this like so many times. I've definitely talked
Yes.
about this enough.
Yes.
And
Yes. Feels.
it was, it was still stuck. And I'm like, okay. And I guess it wasn't until I really delved into Chinese medicine, and then began getting kinesiology and other modalities as well, that I was like, okay, the energy is stuck. There's stagnation in my body, and that the energy of that emotion needs to be moved rather than me just intellectualizing it. Yeah.
Absolutely. Yep. Yep. That somatic stuff is incredibly important. I think it's
Mm.
a balance of like a few modalities, find what works for you. And it's just a few pieces of the puzzle that can really, really help. Hey.
Yeah, definitely. Definitely. Yeah.
Yeah. No, awesome. So in a session,
Hmm.
so you're going in, you have a chat to them, they lay on the bed 45 minutes, popping in the needles. Do you generally leave them in the room on their own for X amount of time, or do you do any sort of trigger point stuff in between, or like just so someone gets a picture of what it looks like?
Yeah, again, it's kind of different person to person, but yeah, generally initial consult will be lots more talking. So we might talk about the reason they're coming in quite in depth, but then because it's such a holistic medicine, I will ask them so much else as well. So if they're coming in for women's health stuff, we'll talk all menstruation, all of that. And then we'll talk about sleep, we'll talk about emotions, we'll talk about bowel movements, digestion, what they're eating, the list goes on. So it's really quite in depth. And then they'll get on the table, I'll pop the pins in. And then depending on what they need, I might use a little bit of moxa. So I will stay in the room there with them to use a bit of moxa, which is a herb that we burn. So it's made of dried mugwort, and we just burn the end of it, sort of thing. Well, there's different forms of moxa, but I use moxa stick usually myself. So we'll burn that, and it will just heat the pins. So it's quite nice. It's a bit different to having a heat pack right on the skin where you kind of get a little bit hot or clammy. It's really subtle. So it's a
Wow.
beautiful warmth. So we'll use that. Occasionally I will leave the room and I'll use a heat lamp instead. So just depending on, I think, what they require. Usually if I'll use moxa if I feel like they're really deficient and I want to really build the blood a little bit more, or build
Yep.
the yang. But yeah, oftentimes I'll use a heat lamp as well, which is equally as beautiful. It feels great. And then, usually I'll pop out and let them rest for at least 15, 20 minutes by themselves. So I'll just pop some music on and let them have a little chill. And then usually when I come back in, they usually have had quite a good acu nap. So that's always good.
Nice.
And then follow-ups are, just touching in on, how have things changed in the past week? How have you been feeling? Just kind of touching in, and then straight up on the table. If I'm
Nice.
treating more kind of musculoskeletal type stuff, I do still do a bit of body work as well. I have a background in remedial massage as well. I studied that before I started acupuncture. And so I do find myself doing a little bit of body work if that's required, if I'm doing a musculoskeletal type treatment, but I don't tend to do too much of that anymore. I don't see too much of that anymore, but certainly, if someone comes in with neck pain or lower back pain, we'll put the pins in, and we might do some cupping or some gua sha or some massage as well. So just depending on what they need. So it looks different from person to person. And it looks different from pathology to pathology as well. I could have 10 women with the same diagnosis, but they won't get the same treatment. It's really individualized, So, yeah.
Well, amazing. Good on you. Like a magical worker. I love it.
Thank you.
Yeah, I can't recommend this stuff highly enough, just from my own experience. It's literally life-changing, and you feel so good. Like, you just feel the change and the improvement in your body. Like, even for me, like mental clarity, lowering the stress, like helping with the cycle, the symptoms. Like, it's just, it's
I really notice when I don't have it now. And my aim is, at the end of the day, if I'm doing my job right, I want to get you to a point where you don't have to come back, right? I want you to be able to, go and enjoy your life and not have to come back, but certainly it does excel at that kind of preventative medicine too. So I do have a lot of clients that just kind of touch base once a month, maybe once every 2 months now. But every time they come, it's like, oh, thank goodness.
I really needed this.
It's just a beautiful tool for preventative care as well,
Absolutely.
One of my very first classes in Chinese medicine, I think it was Foundations of Chinese Medicine or something, first semester, first year. And I remember they were talking about back 2,500 years ago, the dawn of Chinese medicine, the village healer, they would actually pay the villagers would pay the village healer to keep them well. So like if they had to come and see the doctor because they had come down with something or they're unwell, he wouldn't get paid until they were better. And I just, it blew my mind. And I remember thinking that day, oh, that's going to stick in my brain forever, because I just thought how different the system would be if our Western medical system was framed like that now.
Whoa, that would be so different. Oh.
The incentive is to keep people well. The village healer he didn't want people in his clinic.
Oh, and now it's like you go into the GP.
Keep them well.
Yeah. And now you go in for 10 minutes and you know nothing about me, but just by giving you the smallest amount of information, they'll give you something. And it's like, oh, hang on, we got to really stop and ask more questions and have more time with this human being and be like, what's really going on here? Let's unpack some more so we can really, and just
definitely.
Yeah.
And further investigation. I think there's a real lack of further investigation. I get so many women, and it's happened to myself as well, where they've repeatedly gone back to try and get answers about something, and they just go, bloods are fine, you're all good. Yep. And it's like, no, I feel not well. There has to be something.
I do not feel fine.
Yeah, exactly. And so, I just think it's my goodness. I think it is. I do think it is getting better, but there's definitely a lot to be said there as well. So we look at, and I think that's where Chinese medicine really excels, is because, okay, maybe your labs say that you're fine, but let's have a feel of your pulse, have a look at your tongue, let's palpate your belly. We can determine things beyond that scope of looking at the labs. And also too, we have different labs that we go off to. Like we have different parameters.
Yes.
So oftentimes like a doctor will be like, oh, your vitamin D is at 70, you're sweet. Well, I would like to supplement if you're below 100, but the GP might not supplement till you're below 49 or 50. So like that's a significant difference as well. So I often will say like, bring your labs in and we'll have another look at it, because I'm not sure if, you know, you are well. So
Exactly.
but also just what we can pick up energetically with the pulse, the tongue, palpation, you know, looking at someone's complexion, the, you know, the shine of their hair, or you know, is it dry? Is it, you know, like
Oily,
we can tell so much about the body just by like really observing. And I think GPs don't do that anymore. They used to feel your pulse. They used to take your blood pressure, and then, you know, they might, you know, they used to look at you and ask you questions. And now they just don't have, I feel sorry for a lot of them, to be honest, because they really just don't have the time, and they have the you know, the powers that be, you know, there's the pressure there to just get through as many clients as possible. And it's hard, you know, like no wonder people aren't getting anywhere, because they're not being truly observed or listened to or investigated properly, I think. So, yeah.
Yeah, I completely agree with that statement.
Yeah.
And I think it's just it'd be good to see, you know, I hope this conversation inspires others to ask more questions and to seek other modalities to help. Like, you know, GPs have a place, but also looking outside a little bit, go try acupuncture, kinesiology, like your naturopath.
Definitely.
Ask more questions and get like lots of information. That's basically what I've been doing as an experiment with myself the last 12 months. It's just getting and finding what works for you. Try different things. Don't just, if it doesn't feel right, if what they've said or given you something, yet do this, you're like, oh, but okay, I'll do it, but it doesn't really feel right. You got to listen to that and start, you know,
100%.
looking at
100%. And there is a place for GPs, and there are some wonderful GPs out there. So if you are not getting adequate, like if you're not feeling heard or taken seriously by your GP, find another. Try some other modalities too, but also like find the right GP for you as well, you know, because there is a place for them. There is a place for them. I'm certainly not anti Western medicine by any means, but I can just see where it could be done better. And I'm like, let's do a little bit better for our, you know, for our women especially that are, you know, getting gaslit and, you know, just But
absolutely.
just feel empowered enough to seek a second opinion. You know, you don't have to. You can shop around. You can shop around for a GP. You can shop around for any practitioner, whether that's, you know, if one doesn't, you know, work for you or gel with you, like don't be deterred to trying someone else. And just, you know, be empowered with your healthcare too. If you know you're not feeling well, you are the authority on your body. You are the utmost authority on your body and how you feel. They might have some skill and expertise, but you know better than anyone else when something is not right in your body. You're the only one feeling it, right? And so I say time and time again to clients, if your GP is saying bloods are fine, see you later, advocate for yourself. Advocate for yourself and say, and you can request testing, you know, and sometimes it is hard. I know they you know, financially speaking, I think it's hard for some people because they might not put certain tests through bulk billing and stuff like that. But get what you can bulk billed, and then, you know, if you need to get some other testing, we'll try and find another way to get some testing. But just advocate for yourself, you know, like you know better than anybody.
Absolutely. You know you've been in this body forever. So absolutely.
No one else has been in that body but you.
Exactly. But you. That's some really, really great advice. So I'll just try and bring it into a close. We have been going for a bit over an hour. Do you have any other information or advice you'd like to share with our listeners?
Yeah, I mean, I think just I'd like to drive home, advocate for yourself, you know. Yeah, find someone and just trust in your body as well, you know. If your body is telling you something, symptoms are a message. You know, I think a lot of times, especially with menstrual stuff and hormone, like women's health stuff, you know, I think our sex education has failed us a bit. And, you know, I think really driving home that, okay, yeah, it's not, it might be common to have period pain or heavy periods, but it's not normal.
It's not normal.
You know, like, yeah, listen to your symptoms, you know. If you are feeling super like PMDD, really down in your luteal phase, that's your body reaching out saying, hey, look at me.
Yo.
You know, something, you know, yeah.
Listen, I'm over here.
Yeah, don't just go, oh, you know, I'm a woman, it is what it is, you know, I just got to cop this sort of thing. Like, I think we've been kind of indoctrinated to believe that story, but in Chinese medicine, it's not, yeah, just because something is common in this day and age doesn't mean it's normal. If you listen to your body, if your body's trying to tell you something, it's trying to tell you something. In Chinese medicine, the menstrual blood is called tiangui, which means heavenly water. And I think it's so beautiful and poetic, and how different I think we would perceive our hormones and our menstrual bleed and all of it if we looked at it as tiangui, if we looked at it as heavenly water. I think the way that we learn about our bodies in Western medicine, sexual education is just so subpar, and it's seen with such there's such a stigma around it that I think we're not talking about it, and it's seen as like a burden, you know, and then we do normalize these things that aren't normal, like, you know, pain, PMS, heavy bleeding, heavy clotting, like all this sort of thing. Like these are signs from our body, and yeah, should be heavenly water, should be tiangui.
Yeah, it's beautiful.
Yeah. Yeah, I
Oh,
think we just
wow.
need to shift this perspective a little bit. Yeah.
Yeah, reframe that. Like, just
Mm.
yeah, that's gorgeous.
Yeah. Yeah.
Ah, beautiful. Oh my goodness. Thank you for sharing that.
Mm.
And I'd just like to finish up with a few personal questions. It's just reminding women how amazing they are and seeing, you know, the good in them. So I'm just going to throw a few questions at you. You can short answer
Mhm.
or whatever feels right.
Yeah.
But so what is one thing you love about yourself?
Mm. Yeah. Yeah, that's a good question. I would say it's taken a long time to get here. I'll be honest. I think that's most women, right? I
Absolutely.
think I do really love and appreciate and admire about myself my compassion and my empathy and my drive to be the helper, I guess. Um, I think that I used to think my sensitivity was a weakness, like that I was hypersensitive and don't be so sensitive and you take on everybody's stuff. And I think now I've come to a place where I really admire my sense of empathy and my compassion and kindness. It's a superpower. It makes me it makes me the healer that I am, you know, and so I think I really love that about myself. But it has taken a while to get there.
Yeah, it's a process, isn't it? This
It
self-love
is.
and what we yeah, that's beautiful. That's really nice. And it
Yeah.
really shines through the passion and, you know, love for what you do for others. So it's really it's amazing. Yeah, I really
Thank
admire it.
you.
Um, if you could hang on. What is one thing that lights you up? Or one thing that you do that lights you up?
Um, Honestly, right now it is acupuncture. Like I live and breathe acupuncture and Chinese medicine and women's health, you know. I love what I do. Like I don't think there's ever a day where I think, oh, I got to go to work, you know, like I actually genuinely love um what I do. And so that really lights me up every day. It really does. Yep.
is awesome. That's what we all need,
Yeah.
don't we? Somewhere we can go. You just
Yeah.
really want to get up, go and do it, and not feel like you're
Yeah.
going to work. Like it's just
Yeah.
you love what you
Yeah.
do.
I would do it for free. I'll be honest, I would do it for free. But, we live in the modern world.
That's right. We've got mortgages to pay and food to
Yeah,
buy and pay
that's
for our
it.
own you know, our own work and our own acupuncture sessions and all that kind of stuff.
Exactly, exactly.
Um, if you could change anything, what would it be?
Um, I don't know if I would change anything. I think in my, you know, I think in everyone's lives, like you get to a place through the experiences that you've had, right? Like I've definitely had some challenges, some health challenges. I've definitely had some um, some family or childhood challenges, I guess. But I think I wouldn't change it because it's made me who I am. And I think having had the experience of particularly my health stuff um, has made me a better practitioner. And yeah, I wouldn't change anything actually. Thinking about it, yeah.
Yeah. Oh, that's lovely.
Mm.
Oh, good on you. Um, if you could say one last thing to our audience.
Um, just yeah, like I just want to drive home, be empowered in your health, and yeah, in your story, back yourself, trust what your body's telling you, and you could always feel better. You could always feel better, and yeah, just be open to trying different things and seeing different people and finding your community, I guess. Yeah.
Absolutely. That's some really great advice. Um, well, thank you so much for coming on, Rachel. You're amazing. Thank you so much for what you do. And thank you for coming on and sharing all the amazing information. Hopefully, it's inspired others to go out and give acupuncture a go. It's incredibly helpful. But yeah, thank you so much. Amazing human being. Like, I really appreciate you. Thanks so much.
Oh, thank you. Thank you for having me on. Likewise. Thank you.